Hey everyone, good day to all. Myself Dr. AJ Moria. Today I would like to discuss about guys some most important, some golden points from the OB and gynae. Okay, now this is going to be the only important points. And the next video I will try to share the some important images from the OB gynae. Okay, now so guys, you can also follow me in my Telegram where I'm conducting daily quizzes and the daily discussions in the Telegram. You can just search in the Telegram Fmge aspirant at AJ Moria, and also you can just ping me in my Telegram. User ID is omeprazole 40 milligram. Okay, please feel free to chat with me. Okay, so guys, so next let's begin. Okay, so guys, the first one is the guys about the fistula. About the fistula. So guys, from the fistula, guys, you are going to get the one MCQ for sure. Always you are getting the one MCQ. You can see here that this is the 22 and 23 exam FMG examination. You are getting the 111 questions. So guys, we are having the fistulas, guys. Uterovaginal fistula, vesicovaginal fistula, uretrovaginal fistula. The guy, this is the vagina. Vagina is going to connect. Is going to connect from. Is going to connect to like this is utero. Vagina is going to connect it to the ureter. Next one, vesicle, bladder. Bladder is going to connect with the vagina. Urethra means urethra is going to connect with what? Vagina. See here, this is the fistula forming. Okay, now see here, this is also called as three swab test. Three swab test. Okay, now this is the upper one, middle one, lower one. Okay, now upper one is the ureterovaginal fistula. Middle one is the vesiculovaginal. Uretrovaginal is the third one. Lower swab. In the examination, guys, they are not going to give the see the examination. They are going to mention the like here they're going to mention the example in the middle swab. Which middle swab is the this one. This is the vesicovaginal. Answer is vesicovaginal. If they say they're going to do the stain with the methylene dye blue with the first one, it is a ureterovaginal. That's why you have to mark the answers. Okay, now these are the questions. So guys, please see here. Coming to the ureterovaginal means ureter is going to connect with the vagina. See here, the first one is the symptoms are continuous dribbling of urine from the vagina, plus there is a normal urination. There is normal urination is the chief complaint. Okay, next one is the vesicovaginal. There is a continuous dribbling of the urine from the vagina, but there is a no normal urination. Okay, now here, guys, uretrovaginal. This is the no continuous dribbling of urine. Okay, now because you know what? Here, dribbling of vagina, but the patient sits for the urination and urine comes out from the vagina and the urethra. Okay, now because urethra is connected to the vagina. That's why. Okay, now see here. This is going to be the fistula, guys. Please remember that one. Okay, now no more doubts. Next one, guys. Okay, next is the management of eclampsia. Please remember, guys. Let's just remember the definitions here. What is gestational hypertension? It means when the blood pressure recording detected after 20 weeks and return back within the normal within 12 weeks. It's called as gestational hypertension. What is chronic? If it is detected before 20 weeks, it's called a chronic hypertension. Okay, na? Eclampsia means I think everyone knows about this one, the tonic-clonic seizure. Tonic-clonic seizure in the pregnancy with preeclampsia hypertension. Okay, now let's see how we are going to manage the eclampsia. Eclampsia, the drug of choice will be the MgSF4, magnesium sulfate. We have to use the Pritchard regimen. Okay, now see here. See here, guys. The loading dose. The loading dose will be the 4 gram IV over 4 minutes immediately. Next, followed by 10 gram, okay, IM and 5 gram in each buttocks. Okay, 10 grams IM, that is, you have to give divide into 5, 5, 5. 5 1 buttock, 5 1 buttock. Maintenance dose is 5. Okay, na? So guys, please tell me what is the therapeutic dose of the MgSO4. Please comment it. Okay, therapeutic dose. Next one, guys, this is the So guys, before giving the MGSO4 guys, you have to check for the, you have to always check either, okay na? You have to check there must be positive deep tendon reflexes. Positive deep tendon reflexes, the urine output must be 100 ml in for 4 hours. And there is a respiratory will be always have to be more than 14 beats per minute. Okay na? What is the antidote is the calcium gluconates slow IV. Toxicity. MGSO for toxicity is a IV calcium gluconate slow IV. What you go? Okay na? So guys, if there is a toxicity, guys, if there is a, if suppose example, if the MGSO for concentration is there, if there is more than 10 milli equivalent, okay now, then it is called the Niger. There is a loss of the Niger. This is the first sign. More than 12, it is a respiratory depress. More than 15, it is a respiratory paralysis. Cardiac outputs will be less. It is if it is more than 20, more than 25. Okay. Next, guys, management of the hypertension. Preeclampsia is the always the first choice will be the labetalol. Labetalol. Please check the history. Either the patient is having the bronchial asthma or not. If the patient is having the asthma, you have to give the CCB, nifedipine. Okay, na? For the chronic, you have to give the methyl dopa. For the refractory hypertension, you have to give the sodium nitroprusside. For the prevention, guys, you have to give the aspirin. What are the contraindicated? ACE inhibitors, ARBs, and diuretics. Okay, na? Diuretics. Okay. Please remember this one. Done. Next one, guys. See here, guys. For the mild preeclampsia, patient can be managed with the close fetal and maternal monitoring by use of antihypertensive like labetalol. Termination of pregnancy is done at more than 37 weeks of gestation. For the severe preeclampsia patient with the BP more than 160 over 110 with the proteinuria 3 plus diptychs and diptych positive, there is a urine positive, then the signs of the end organ damage. The first management is the MGSO4 to prevent the convulsion, and second, we have to give the labetalol and the definitive management by termination of the pregnancy more than equal to 34 weeks. In case of eclampsia, guys, where the convulsions have occurred, the first you have to secure the airway. Then you have to give the MGSO4, then give the labetalol, and immediately deliver the irrespective of the gestational age. Mode of delivery is vaginal, and pH is not an indication for the C-section, guys. In patient with HELP syndrome, immediate termination of pregnancy is done if there is a more than equal to 34 weeks, but if there is a less than 34 weeks, guys, give the steroids and deliver after 48 hours. Just remember this, guys. Just you have to remember this one. Okay. Next one is the diabetes in pregnancy, guys. Diabetes in pregnancy, guys. It is seen between 24 to 28 weeks. Okay, 24 to 28 weeks of gestation. Okay, na. See, guys, screening of all pregnant females start at the first antenatal visit. If it's normal, then you have to repeat at the 24 to 28 weeks of the gestation. One step screen test adopted by the WHO female is fasting, 75 grams. This is a oral GTC, oral glucose tolerance test. How much you have to give? You have to give the 75 grams of the oral glucose before doing the random blood sugar. Okay, now then there is and also guys, there is 3 values are taken. Anyone positive diagnosed with the gestation diabetes meltus. Okay, so guys, here fasting must be more than 92 1 hour, more than 82 182 hours, more than 153. Here, guys, if the fasting is more than 126, guys, or 2 hours is the more than 200 milligrams deciliter, it is diagnosis of the diabetic overt diabetes. The random blood sugar is more than 200, it means with the symptoms, and if the HbA1c is more than 66.5% in the first trimester, it is also diagnostic of the overt diabetes. Okay, now just remember, guys, what are the fasting one here, and remember the 24 to 28 weeks, 75 grams. Okay, now just follow me where I'm going to mark the answers, marking the important points here. Okay, now see guys, for this guys, there is always the drug of choice will be the insulin. Okay, now always the drug of choice will be the insulin only. Okay, now 40 international units. Okay, na? And also there is a drugs, some approved drugs that are like glyburide or can give the metformin. Okay, now the most common malformation is the CVS. Okay, na? Cardiovascular system, cardiovascular, and the most common congenital anomaly is the VSD. Is the VSD. The most specific overall is the sacral agencies. The sacral agencies. What are some fetal complications, guys? You have fetal hyperglycemia, macrosomia, weight will be more than 4 kg, shoulder dystocia, and the abortion, guys. Okay, now you have to just study the time of delivery, guys. Okay, it's also important. This is what you need to do. This is what you need to remember about the diabetes in pregnancy. Okay, now done. Next, guys, study about the placenta previa and the placenta and the abrasio placenta. Placenta previa is the bright red color bleeding. Remember, guys, the bright red color bleeding. There is a painless bleeding. Okay, this is a painless bleeding. Painless bleeding, and uterus is soft, non-tender. Uterus soft, non-tender. It is the placenta previa. Treatment will be the McAfee and Johnson regimen. Okay. There, guys, for the abruptio placenta, guys, remember the dark red color. Bleeding is the what is the blood is like a dark red color. There is a pain, and also there is painless is the placenta previa. Painful is the abruptio. The history of the abdominal trauma, hard. There is a tender uterus. Okay, there is a tender uterus. Remember the tender uterus. Okay, there is a concealed eruption. Okay, concealed eruption. Okay, abruptions. Remember this one. Remember the triad of the ectopic pregnancy. There is a abdominal pain, amenorrhea, vaginal bleeding. Is the triad of the ectopic pregnancy, guys. Here, what is the most common site is the fallopian tube. Fallopian tube. Most specifically is the ampulla. For the management, guys, it must be the management for the management of the ectopic pregnancy, guys, must be the unruptured ectopic pregnancy. Sac size will be must be less than 4 centimeter, and the beta HCG must be less than 5,000 international unit. There must be the fetal cardiac activity. There is the fetal cardiac activity must be absent. Okay, now please see here also that the methotrexate will be the primary treatment for the ectopic pregnancy. Okay, now you can see the what are the doses and the how much is the okay follow up. Okay, also guys, there is a can see here the important signs. Guys, here the Chadwick or Jacquemus sign. There's a bluish discoloration of the vagina and the cervix at the 6 to 8 weeks. Okay, now Wasender sign. There's a pulsatility in the lateral phalanx. You can see in the 8 weeks. Goodale sign, softening of the uterus, softening of the cervix in the 6 to 8 weeks. Hager sign, softening of the isthmus, 6th week. Fetal movements can be felt by the mother at the 16 to 18 weeks in multigravida and 20 weeks in the primigravida. There is a Braxton Hicks sign. There is irregular pain contraction palpable after 16 to 18 weeks. Okay, now done now. Okay, next one. Next one is guys here. Anticoagulants in pregnancy, guys. Okay, now come here, guys. This is see here, guys. Warfarin. Okay, see warfarin. Warfarin is contraindicated. Warfarin is contraindicated in the first trimester only. Warfarin is contraindicated in the first trimester only. Okay, now in other trimester, in second, third, you have to give the just change to the warfarin. Okay, I think everyone know about this one. Okay, now in the first trimester, guys, you have to give the heparin. That's why you have to give the heparin because warfarin is contraindicated. Heparin example, enoxaparin. And then you have to 13 to 36, guys. You have to next, you have to again shift to warfarin. Done. Next one is, guys, polyhydramnios and the oligohydramnios. This is liquor liquor is low. More liquor is the polyhydramnios. Low liquor is the oligohydramnios. Examples are, you see, in the case of anencephaly open head. That's why there is more liquor. Esophageal duodenal atresia, esophageal and duodenal atresia, macrosomia, maternal diabetes mellitus, and the diaphragmatic hernia. These are the examples of the polyhydramnios. Oligo, less. Renal agencies, IUGA condition, preeclampsia, uterine insufficiency, history of there is a NSAID uses, and there is a postpartum pregnancy. These are the example under the oligohydramnios. Okay, na? You guys see here the Leopold maneuvers. I think everyone perform in your college days. College days, guys. Okay, na? Okay, na? Remember this is the what? Leopold 1, 2, 3. Okay, just try to. You have to refine the guys. The surface of the domain is the palpable. Okay, now I didn't mention the names here, guys. It's the polyp shape. Here the polyp like. Okay, now what you have to see here, the superior surface of the fundus is palpable to determine the consistency. Yes, guys, here. Okay, I forgot the names of the Leopold manuals here. We just remember, guys. This is the, I think this is the polyp. This is the polyp type. Okay, and this one. Let me confirm this one. Wait long. I just forgot in the. I know that one. Leopold. Sorry for that one. This is the fundal grip, umbilical grip. Okay. Fundal grip. Okay. Fundal grip, umbilical grip. There is a polyp grip. Okay. Fundal grip, umbilical grip, polyp grip. This is the fundal grip, umbilical grip, polyp grip, pelvic. Okay. Okay, guys. See here. Sorry for that one. I just forgot that one. Okay. This is the fundal grip. This is the fundal grip. This is the polyp grip. This is the what? This is the fundal umbilical polyp. Sorry. Fundal umbilical polyp. This is the pelvic. Okay. Okay, now. Wait long. Fundal. Fundal. This is the umbilical, polyp, and the pelvic. Okay, na? Okay, done. Okay. This is the fundal, umbilical, polyp, and the pelvic grip. Okay, na? You have to remember, guys. So guys, they will just give the images, and then you have to identify. Okay, na? Next one, guys, to the PCOS versus the OHS. PCOS versus OHS. This is the polycystic ovarian syndrome and the ovarian hyperstimulation syndrome. Okay, now see here. See, guys, you have to remember this one, guys. This is the case of the. It looks like the pearls. Okay, now string of pearls appearance. This is the string of pearls appearance. This is the case of the necklace of. This is in the necklace. The see here necklace of. This is the seen in the necklace pattern. Okay, now. See here, guys, what happens here? This is the small follicles arranged at the what? Arranged at the periphery. But here, see the multiple big follicles. There's a multiple big follicles with the ascites plus the history of the IVF treatment. History of the IVF treatment. Okay, na? History of the IVF treatment. They will mention. This is the ovarian hyperstimulation syndrome. Coming to the PCOS case, there is a small multiple follicles here. Okay, small multiple follicle arranging is called as the string of pearls appearance or the necklace pattern. Okay, now you can see that it follows the rotard, called the rotardum criteria. You have to out of 3, 2 is required for the diagnosis of the PCOS. Okay, now just remember this: amenorrhea, hysterism, and there is a presence of the more than 12 are equal to the more than or equal to 12 follicles in either ovary. Okay, now, and the ovarian increase value of the more than 10 ml. Okay, done. The first drug of choice will be the letrozole. It is the letrozole. Okay, it's the letrozole. Next is the second line choice is the clomiphene citrate. The side effect will be there is a hot flashes. Hot flashes. Tamoxifen leads to endometrial cancer. Metformin is given to the, like in the case of the insulin resistance. Okay, now there is going in the pictures, guys. There is going to the formation of the acne formation. Okay, now, and also the it also happens in the most of the fatty obese patients. Okay, that's why there is going to be the resistance of the insulin. That's why you have to give the metformin here. Okay, now irregular cycle hysterism, you have to give the drospirenone. Okay, now irregular cycle hirsutism acne, you have to give the cyproterone estate. Cyproterone estate. I think done. Next one, guys. This is the twin pregnancy. You have to remember, guys. This is the you have to remember this is the dichorionic, the diamniotic. This is the TCDA. This is the MCDA. Okay, na? Please here this is the guy. This is the lambda sign here. This is the lambda sign here. This is the T shape. This is the lambda sign here. The T shape. Lambda sign is the dichorionic, diamniotic, and okay, in the monochronic diamniotic there, see the MCDA. See in the case of the okay, you see the T shape. Okay, the T shape. Okay, na? The most common will be the DCDA. It's most common will be the DCDA. If the division occurs less than 72 hours, is going to formation of the DCDA. Within the 48 days, it is the MCDA. More than 8 days, it is the MCMA. Okay, there is a the division occurs more than 12 days, it's going to the conjoined twins. Okay, the most common variety is the thoracophagus. There is same sex plate group and the HLA typing, but there is a different fingerprint. Okay, there is a twin to twin. There is a twin transfusion syndrome occurs in the MCDA. Okay, na? Also, guys, remember the best time to see is the 11 to 13 weeks, and the complication is prematurity. Okay, now see here, guys. If there is a both cephalic and the vertex, you have to do the normal delivery. First cephalic and the second breech, you have to do the normal delivery. There is both breech and the transfer, you have to do the elective C-section. Okay. Also, please remember this one, guys. This is the physical changes in during the pregnancy. See here, the respiratory gas is the mnemonic is the ICTV movies. ICTV. I means IC inspiratory capacity, TV tidal volume, M movies MV minute ventilation, which are increases. What are constant? IRV, I for inspiratory reserve volume, R for respiratory rate, V for vital capacity. Please remember here, guys, all the clotting factors are increases. Okay, na? Except 11 and 13. Okay, na? Except 11 and 13. Okay, na? All the clotting factors are increases except the 11, 13, which are decreases. Okay. Please remember what are increase and what are decrease here. GFR, blood volume, plasma protein, has hemoglobin mass, RBC, erythropoietin, they are going to increases. Decreases hematocrit value, hemoglobin concentration, platelet, BP, PR, and the blood viscosity, they are going to decreases. Okay, now remember here, guys, this is the cardiac output begins at 5 weeks. Maximum cardiac output is at 28 to 32 weeks. Cardiac output come back to normal after 10 days of the delivery. Remember here, after 10 days of the delivery. Continuous murmur, it is normal. If there is diastolic murmur, it's going to be the heart disease. There is a S1 sound. This S1 sound is loud and splitting prominent. S2 is normal. If there is something going to happen with the S2, it means it is not normal. Okay, na? Actually, S2 is going to be normal in the case of the pregnancy, guys. Okay. Also, please remember here the Sheehan syndrome. I think everyone knows about Sheehan syndrome. There is a uterine sync, necrosis of the anterior pituitary gland plus PPH plus failure to lactate the baby. Okay, na? By seeing this history, how to mark the Sheehan syndrome. Next is the Asherman syndrome. Asherman syndrome, there is due to hypomenorrhea, history of curettage and dilation. As sorry for that one. Here in the Asherman syndrome, you will see the You'll see that there is a uterine synecdoche. Okay, uterine synecdoche. The most common cause of secondary amenorrhea is the pregnancy. Most common cause of primary amenorrhea is the ovarian dysgenesis. There is a Kalman syndrome that is a 46XX due to decrease in the GnRS. The symptom will be the anosmia. Okay, na? Turner syndrome 45XO, strict ovaries, webbing of neck, and there is a shield chest. Everyone knows this. Cryptomenorrhea, hidden menstruation, guys. This is amenorrhea, cyclical. There is a cyclical abdominal pain, urinary retention, suprapubic pain. Okay, now is going to be the, and also the imperforate hymen. Okay, now there is imperforate hymen. Okay, the treatment will be the cruciate incision. Cruciate incision is a cruciate incision on the hymen. It's a oligospermia, guys. I will come about this one in the next upcoming PPT slides. Because endometriosis, I think everyone knows about the chocolate cyst. TBS is the diagnosis, and the adenomyosis, fibroid. Guys, remember the cellular cells. What cellular cells release inhibin and also the help in the spermatogenesis. Lady cells helps in the release the testosterone. Okay, now remember the most common is the intramural fibroid. Here, okay, sorry. The most common will be the subseral. Okay. Like see here, they will just give the images here, guys. They just give the images, the how to identify the which one is the, this is the subseral fluid, subseral fibroid. This is going to the submucosal fibroid. Okay, now this is the intramural fibroid. Okay, you have to mark the answers. Okay. Next one, guys, you have to remember this is the shoulder. This is the case of the shoulder dystocia, guys. This is the shoulder dystocia. Define the shoulder do not deliver within 1 minute of the, okay, now within the 1 minute of the delivery. Okay, now so yeah, that's why it's going to cause the brachial plexus defects. Can cause the brachial plexus defect of the C5 C6. Okay, now so guys, if there is a shoulder dystocia, guys, what you have to do? Remember the mnemonic is the helper. First of all, you have to do the call for help. Call for help. Next is the perform the leg maneuver. That is the Roberts maneuver. You have to flex the leg of the mother and against the abdomen and then abduct. It is the abduct. Okay, now you have to abduct that. It is the Roberts maneuver. First of all, it is the most commonly injuries. While doing this one, guys, the most commonly involved nerve is the damaged nerve is the lateral continuous nerve of the thigh. Okay, now next one is the guys P for the giving the suprapubic pressure, also called as Rubin 1. That's why suprapubic pressure with the leg maneuver is called as the Rubin 2. Okay, now there is last time there is one question about this one. If the Roberts maneuver failed, what you have to do? You have to do the suprapubic pressure. Okay, now next one is the E. Enter the maneuver. The example is the wood corkscrew maneuver. Is the wood corkscrew maneuver. Okay, now the correct maneuver in delivering shoulder discharge are progressively rotating the posterior. Rotating the posterior. Okay, na? Rotating, where is that? Okay, na? Rotating the posterior shoulder at to the 180-degree in the corkscrew fashion. Okay, in the corkscrew fashion. Okay, na? Then, guys, the last is the remove the posterior arm forcefully, roll on the four limbs, also called as Gaskin maneuver. This is the Gaskin maneuver. This is the Gaskin maneuver. Roll on four limbs. Okay, na? The last stage, guys, if it is all fails, you have to push the head back and do the cesarean section. Okay, now remember this one. Also, guys, there are types of abortion. Spontaneous abortion, unexplained natural abortion is called as spontaneous abortion, guys. There is a most common cause is the chromosomal abnormalities. What is recurrent abortion? It is defined as the sequence of 3 or more consecutive spontaneous abortion before the 20 weeks. It is called as remember the 20 weeks is the recurrent abortion. Please remember this one, guys. Threatened abortion, inevitable abortion, incomplete, complete, missed. Okay, na? Okay, guys. Please remember the table. Just remember, guys. Okay, remember the history and there is a cervix is open or closed. Okay, please remember the okay. There is a chance of coming one MCQ from the abortion. Okay, and also, guys, I think everyone knows about this one. Types of what is pelvics? Pelvics, guys. Just remember, guys, this is the gynecoid, android, and arthropoid, the platypoid. The most common is the gynecoid. The most prominent inlet is most prominent is the android phone. Most prominent arthropoid, guys, it is the face to pubis delivery. There is a platypoid. This is the least common. Remember that here, guys. Most favorable is the gynecoid. Least favorable is the least favorable for delivery is the least common is the platypoid. Okay, na? Least favorable for delivery is the android. The OP position is the android. See, the also a question here. They ask question for the face to face is the arthropoid. Yes, you will get the one MCQ. Okay, mark my word, guys. They're going to get the one MCQ from this table. Also, guys, please remember this is the parable. See the what is the after after delivery, guys. There is the Lochia. Okay, there is a see the types of Lochia is the Lochia rubra, Lochia serosa, Lochia alba. Lochia serosa, it is a red color. Lochia rubra red. Lochia serosa pink. Lochia alba white color. Okay, now what they see, guys? Please study the compositions. Okay, this is also going to be the important one, guys. There may be the question, or else, guys, you have to remember the there is a see. Remember, this is a rupees. First rubra, then seroja, then alba. Rupees A. Rupees A. Okay, na? Rupees RS plus the alba only. Guys, remember, guys, there is a one question in the last Fmge examination, guys. Guys, pregnancy, guys, nausea and vomiting. Here, guys, remember can we minimize eating? See here, guys, is a eating small meals at a frequently interval available. Okay, na? Here. Treatment of pregnancy associated nausea, vomiting seldom provides complete relief, but symptoms can be minimized by eating small meals at a frequent intervals is available. Okay, remember this one. Okay, na? Eating small frequent meals, it can be helps in the treatment of the nausea and vomiting in the pregnancy. Okay, na? Yes, guys, this is the Bartholin cyst. This is the Bartholin cyst, guys. Okay, na? Also called as greater vestibular gland here. I think everyone knows about what is the opening at the Bartholin duct is between the labia minora and the hymen at the junction of anterior 2/3 and the posterior 1/3 of the uvula. What is the function? Alkaline secretion at the time of the sexual stimulation. Okay, na? If there is obstruction, guys, this leads to the Bartholin's abscess. This is the Bartholin's abscess. Most common is the E. coli. Okay, na? First of all, you have to do the magnitude IND, incision dryness. If it's recurrent, you have to do the marsupialization. You do the marsupialization. And then you have to do the excision of the cyst. Excision of the cyst. You have to do the mars superior. Okay, see, we're doing the marsupialization here. They may give the marsupialization treatment like the picture while doing that one. Okay, na? Remember this one, guys. This is the guys CTG. See here, guys, CTG. Here, if there is a early deceleration, see this. What is the early? Which one comes first? Head will come first. Head will come early. Head compression. Late deceleration. Guess late placental deceleration is the late deceleration placental insufficiency hypoxia. Late placental if you read from the reverse, late placental LAT. Okay, remember this. It's okay. LAT late. Okay. See here. Late distillation, placental, late. Just remember late. Okay. See, variable distillation means variable card compression, variable card, VC, video calling card. Okay, na? This is a sinusoidal pattern is in the fetal anemia. Example, vasa previa or H incompatibility, and there is a parvovirus infection. So guys, please remember this is the biophysical profile. Okay, na? BPM BPP biophysical profile is also called Manning score. Just remember, guys, what are included in the Manning score is the breathing, amniotic fluid, tone, movement, and the non-stress test. You will see the do the chart पांच five. Okay, breathing, amniotic fluid, tone, movement, and the non-stress test. Okay, now please remember that there is a modified biophysical profile, which is the non-stress test and the AFI. Okay, done. Next is the guys Bishop score. Please remember the guys in the Bishop score also, guys. Please remember the what are included in the Bishop score. Okay, now there is a direction of the cervix, the consistency of the cervix, direction of cervix, or consistency of cervix, length of the cervical canal, position of the cervix, and the station at the presenting. Okay, now just remember what are included. That will be more than enough. Okay, now. And also, guys, remember if the score is 8, it means it is the chance for the delivery will be favorable. Less than 6, it is the unfavorable. Okay. Next one is, guys, this is the new semen analysis criteria. This is the as per WHO manufacturer semen analysis. Okay, see here, guys. Uh, this one, guys. See, See, count will say, see, count is 15 million. It is the world is the 15 million is the normal, but the latest is the 16 million. The latest is the 16 million. Okay, that is much more than 16 million, which is the normal. Okay, na? Morphology 4%. Okay, na? Next, guys, total mortality is the 40%, more than 40%. Okay, na? Remember, guys, the count will be not 15, it is just 16. Okay, na? 16 is the latest one. Please remember this one. Okay. Next one is, guys, this is the induction and the recommended dose of the anti-D. Okay, na? See here, guys, the mother is RS negative and the father is RS positive. Okay, na? Please just remember this one, RS positive baby. You have to first of all, guys, you have to give the anti-D to the mother. There's always one question, guys. Here, remember this one. See here, for the first trimester and the abortion and the first trimester ectopic pregnancy, guys, you have to give the 50 mcg, 50 mcg microgram. Remember, guys, after last, see, this question is asked in the July examination. In the January examination, in the July examination, they asked the after delivery. After delivery, it is a 300. Before delivery, see, guys, here the first trimester abortion you have to, and first trimester abortion are the medical trimester of pregnancy, you have to give the 50. First trimester ectopic pregnancy 50. Okay, na? Second trimester you have to second trimester you have to give the 300, and the prophylactic at 28 weeks also you have the 300, and the after delivery also you have to give the 300 only. Please remember. Also, guys, please remember this. This is the screenshot of from my lecture. Okay. See, guys, this is a triple marker test done in the 16 to 18 weeks. Quadruple also 16 to 18 weeks, and the dual marker test also is done in the first trimester, 11 to 13 weeks. See here, the triple marker test, you have the triple marker test is the HCG, AFP, and the estriol. How to remember, guys? See the triple marker test. Okay, na? The HCG, H for high, H for high. Okay, na? This is the AFP. Remember like this one, guys. This is the triple. I tried, fall down. I tried, but fall down. Tried means tried, triple, fall down. F means fall down. Okay, AFP, fall down. So, okay, H high, HG, AFP, F fall down. It's low. Estrogen also low. Quadruple, who? Quadruple. Okay, na? Qua, qua. qua. Who came inside? Okay, quadruple means what? This is the who came inside. It is the inhibin A. Inhibin A came inside. In quadruple, guys. See, in triple we have HCG. Hey, HCG, AFP, estrol. But in quadruple, who came inside? It is the inhibin A. See, HCG H for high, AFP fall down, EST fall down, but inhibin who can just now it will be high. Inhibin high, inhibin also high. Dual marker, there is a HCG high, there is a dual marker, it is the पापा का दुआ पापा का दुआ ठीक है पापा दुआ इट इज अ लो ओके ना पापा हमेशा क्या करते हैं प्रेजर करते हैं इसीलिए लो जस्ट रिमेंबर दिस वन गाइस ओके remember this one guys this is a fill in the blanks this is the see height of uterus at what weeks okay na at 12 weeks it is the at the pubis with the pubic symphysis at the level of umbilicus it is at the 24 weeks immediately after delivery it is the lower border of umbilicus just below umbilicus or the just 2 days after the delivery it is the 1 centimeter below the 1 finger breadth below the umbilicus. Also, guys, please see this. So, guys, in the entire gynecology, guys, there are only two conditions in which there is a primary amenorrhea and a absent uterus. This is the Mullerian agencies RMT. There is a complete androgen insensitivity. Okay, na? Remember this one. This is the actually this is the karyotype is the female. This is the male. But guys, this is the gonads are ovaries here and here testes. Remember, guys, how to differentiate between the ovaries here the testes. Here, guys, there is a axillary hair and a pubic hair are present here, but absent in here. Okay, na? Associated anomalies are renal and skeletal defects. Here is nothing. Remember, guys, please remember. Also, guys, see here this one pubic height. I already discussed this one already. This one, guys, remember the lactation sequences, mammogenesis, lactogenesis, lactokinesis, and the galactopoiesis. Remember the sequence, guys, and the what are the hormones involved. Okay. No. Next one is guys. This is the order of the labor. Then first there is a engagement. See ed fear, engagement, descent, flexion. There is a internal rotation, crowning. Next resuscitation, and there is external rotation and the expulsion. Remember the order. Next is the this here we can go into the case of the impending eclampsia, guys. A woman at 32 weeks of pregnancy present with the BP of 170 over 110 mmHg and the urine proteins on the 2+ on dipstick. She is complaint of headache and blurring of vision. No convulsions at the present. Okay, na? There is no convulsions. So, guys, the headache and the blurring vision is the case of the impending edema. Impending eclampsia, guys. Here is the example. Symptoms are epigastric pain, headache, seizure. There is a visual disturbance. You have to do the MGSF for laboratory and also do the intraoperative labor. Okay, na? So, guys, these are some important golden points from my side from the gynecology, guys. Okay, na? Please remember all the points. Okay. Hope you will get the question from this one. Thank you very much. I will meet you soon in the next video. I will upload the images of the OB-GYN. Okay, na? Thank you very much, guys.